Hi, I'm Dr. Kyle Sachaki with Orthopedic One. I'm a fellowship-trained sports medicine surgeon. I did a sports medicine fellowship at Stanford with a dedicated focus on injuries to the shoulder, elbow, hip, and knee. I see patients at the Sawmill and Perimeter locations in Upper Arlington and Dublin. Today, we're going to talk about meniscal injuries to the knee, which is one of the most common injuries that I see in my practice. So each knee has two menisci. One meniscus is located on the inside part of the knee called the medial meniscus, and one meniscus is located on the outside part of the knee called the lateral meniscus. The main function of the meniscus is to protect the surrounding cartilage of the knee by distributing forces across the knee pretty evenly. The meniscus can also function to provide lubrication as well as some stability to the knee in certain patients. There are really two main mechanisms of injury to the meniscus. The most common is a sports-related twisting injury. This typically occurs in younger athletes, and they may report hearing or feeling a pop in the knee when they injure it. Additionally, the meniscus can also start to degenerate over time, making it more prone to injury in older adults without a significant trauma. These patients may develop a more gradual onset of pain compared to those patients sustaining an athletic type of injury. Some of the symptoms that these patients may complain of are pain along the joint line, swelling, and mechanical symptoms such as clicking, catching, popping, or even locking of the knee in certain instances. Knee radiographs are often the first line imaging of choice. X-rays can help to identify other pathologies that may be causing knee pain, such as fractures or even knee arthritis. In cases in which there's a high suspicion for meniscus injury or tearing, or in patients that have tried and failed to improve with conservative or non-operative treatments, then an MRI may be indicated to assess for a meniscus tear. The treatment options for meniscus tears are really dependent upon the size and location of the meniscus tear, as well as the overall health of a patient's knee. For smaller peripheral tears that are not causing significant swelling or mechanical symptoms, non-operative treatment is often successful. This is true for patients that may have significant knee arthritis in addition to meniscus tears. Non-operative treatment typically consists of an initial period of relative rest, activity modification that is followed by formal physical therapy focusing on strengthening and range of motion exercises. Occasionally, braces or oral anti-inflammatory medications or even steroid injections can sometimes be used in the acute period. Most patients are able to return to their sport or daily activities within a few short weeks. Depending on the type of tear and location, the torn meniscus can either be removed or repaired. Both surgeries are performed as an outpatient with arthroscopic knee surgery. If the meniscus is not repairable, then only the torn portion of the meniscus is removed and the remaining meniscus is left intact. This is shaped into a smooth and stable contour in order to reduce the mechanical symptoms and reduce the risk of future tears. The recovery for this surgery is typically unrestricted, with weight bearing as tolerated and physical therapy, with a goal of full return to all activities, including sport, within 6 weeks after surgery. In cases in which we are able to repair the torn meniscus, the recovery is a little bit longer. The surgery is also done arthroscopically. All patients after surgery start physical therapy. They're placed in a brace with some restrictions for about 6 weeks. They typically start running around 3 months after surgery, with goal of full return to all activities, including high level of sports, by about 4 to 6 months after surgery. Outcomes after surgery are generally very successful, with most patients reporting significant improvements in their pain and function after surgery. Although a longer recovery with repair, it is typically favored because it does lead to a higher return to sport, lower chance of developing arthritis in the future, and a lower chance of needing a knee replacement in the future. Meniscal injuries are not always planned, but when they do happen, we are here and available to help you get back to sport or whatever activities you want to do and enjoy doing.